We know that good communication is key to effective support in health and social care. But at the moment, important information about us is spread across different computer systems that don't communicate well with each other. This can make it harder for professionals to access the right information at the right time. That's why Wales is introducing the National Data Resource, or NDR. It safely and securely brings together important health and social care information. Only the professionals involved in someone's care can see their information, and only when it's needed. Let's see how this helps Gwenda. She's in hospital after a fall. Gwenda, her family and doctors agree she needs temporary residential care to recover. Because the hospital, social services and care home are all connected to the NDR, they can all access important details like Gwenda's medication, allergies and care plan. Gwenda and her family don't have to repeat the same information over and over, and there's less risk of errors. The NDR can also help improve health and social care in Wales by providing anonymous data for research and planning. The NDR is being introduced in stages, with social care joining before 2030. The NDR brings your important data together so that professionals can make the right decisions for you and your loved ones. To find out more information about the NDR, visit our website insightcollective.socialcare.wales/data.